My name is Dr. Arthur Hartman. I am 63 years old. Did you know that by the time you finish watching this video today, approximately 20 seniors will receive a devastating dementia diagnosis? That is one person every 66 seconds. But here is what should really terrify you. I spent 35 years in medicine not knowing something that changed everything when I finally found out. Let me tell you what happened. What if the root cause of that dementia isn't just getting older? What if the cause is sitting right there in your own medicine cabinet? You have been constantly reassured that these pills are safe. You are told they are routine. You are told they are absolutely necessary for your health. I used to tell my own patients the exact same thing, but groundbreaking new medical research is raising massive red flags. 99% of seniors have absolutely no idea that at least one medication they are taking every single day could be physically shrinking the critical memory centers in their brain by more than 28% in less than 12 months. I need you to let that sink in for a moment. I know this sounds terrifying. I felt sick to my stomach when I first read the data. Let me tell you something from my own heart. I have seen it happen way too many times in my practice. People trust their medications completely. They blindly assume that if a doctor with a degree prescribed it, it must be harmless. Meanwhile, the pharmaceutical industry has known about these devastating effects for decades. Yet they continue profiting billions of dollars from selling the exact same drugs that may be aggressively accelerating cognitive decline in millions of seniors across the country. In fact, a major 2023 study published in Neurology and Aging Research discovered that one particular class of medications increased dementia risk by 49% in seniors within just 2 years of regular use. That is not a small increase. That is nearly half again the normal risk. In this video, I am going to reveal the 9 absolute most dangerous medications triggering rapid memory loss and dementia. I have ranked them from commonly overlooked to absolutely mind-destroying. And I want you to pay close attention to number 3 on this list. It is prescribed to millions of seniors for something that seems completely harmless, but it can literally shrink key memory centers in your brain. You probably don't even realize it is happening to you right now. Before we dive deep into this crucial information, I want to hear directly from you. Let me know in the comments section below. What medications are you taking every single day? And have you ever experienced sudden brain fog or unexplained forgetfulness right after starting a new prescription? We are reading every single comment. Don't stay silent about this. Speaking up could literally save your mind. Now, without any further delay, let's start at number 9. Do not let its position at the bottom of this list fool you for a single second. This medication is sitting in almost every senior's medicine cabinet right now. It might be scrambling your brain before you even feel the very first symptom. Number 9 is diphenhydramine, commonly sold as Benadryl. Diphenhydramine is that familiar little pink pill that millions of people trust blindly. They use it to help them fall asleep, to relieve seasonal allergies, or to ease their annoying cold symptoms. It is very inexpensive. It is available over the counter at literally any drugstore. You probably have a dusty bottle of it in your nightstand or your bathroom cabinet right this very moment. You may think you are simply taking it to sleep a little better at night. But inside your brain, Benadryl is actively disrupting your hippocampus. That is the specific, delicate region responsible for forming and storing your new memories. Benadryl belongs to a family of drugs called anticholinergics. They work by violently blocking a crucial neurotransmitter called acetylcholine. This is the vital chemical messenger that helps your brain create new memories and maintain your sharp alertness throughout the day. As your brain gets older, it becomes increasingly dependent on every single bit of acetylcholine it can possibly produce. And when medications like Benadryl interfere with that delicate process, the results can be absolutely devastating. According to a 2023 study published in the Journal of Geriatric Cognitive Health, seniors who used anticholinergic drugs on a regular basis had a massive 54% higher risk of developing dementia compared to those who avoided these medications entirely. That is more than half again the normal risk, just from taking what most people consider a perfectly harmless sleep aid. So, how can you protect your precious memory? First and foremost, avoid anything containing diphenhydramine. Look closely at the label, especially if it says PM, nighttime, or allergy relief. These products are very often just Benadryl hidden under a different brand name. If you are currently using it for allergies, there are much newer, non-sedating options available, like loratadine, which is commonly sold as Claritin. These newer antihistamines do not cross the blood-brain barrier. They are dramatically safer for long-term use in seniors. Never stop any prescribed medication abruptly without medical guidance. But please, never assume that over-the-counter automatically means it is safe for your brain. Up next is a medication that is often aggressively marketed as harmless and gentle on your digestive system. Yet it systematically interferes with the very nutrients your brain desperately needs to stay sharp and healthy. Number 8 is proton pump inhibitors, specifically Prilosec and Nexium. These medications belong to a drug class called proton pump inhibitors, or PPIs for short. These drugs are specifically designed to severely reduce your stomach acid production. They are frequently prescribed for heartburn, GERD, and acid reflux problems. I have seen many seniors remain on these medications for years, sometimes even decades. They stay on them because their uncomfortable burning symptoms return immediately as soon as they try to stop taking them. But what is rarely discussed with patients in a rushed 15-minute doctor's visit is how PPIs systematically interfere with the absorption of vitamin B12. B12 is an absolutely crucial nutrient. It protects your brain tissue. It strongly supports your memory function, your daily focus, and your mood stability. In a groundbreaking study from 2016 published in JAMA Neurology, researchers carefully examined over 73,000 people aged 75 and older. They discovered that regular PPI users had a 44% increased risk of developing dementia compared to people who didn't use these medications. By suppressing your stomach acid way too aggressively, PPIs interfere with your body's natural ability to absorb not just B12, but also magnesium and calcium. These are essential minerals for neural transmission and proper brain cell signaling. Without adequate levels of these nutrients, your delicate neurons struggle to fire efficiently. This causes mental misfiring, deep confusion, and scary memory lapses that often look exactly like the early warning signs of Alzheimer's disease. But the medical problem goes even deeper than just nutrient depletion. PPIs have also been scientifically shown to increase the actual levels of amyloid beta plaques in the physical brain. These are toxic proteins that actively disrupt normal brain function. They are considered one of the core drivers of Alzheimer's disease progression. The excellent news is that there are much safer alternatives available to you. If you are using a PPI every single day, ask your doctor whether you can slowly taper off with the help of H2 blockers like famotidine, which is sold under the brand name Pepcid. While not totally perfect, H2 blockers are significantly less likely to interfere with your cognitive function. Next up is a medication that is often prescribed for bladder control issues, but it may actually be wreaking absolute havoc on both your short-term memory and your emotional balance. Number 7 is bladder control medications, specifically oxybutynin. Oxybutynin, which is sold under the brand name Ditropan, is frequently prescribed to seniors who struggle with urinary incontinence or overactive bladder problems. On the surface, it seems like a highly practical and helpful solution. Nobody wants to deal with the daily embarrassment or the severe inconvenience of frequent, urgent bathroom trips. But I didn't know it at the time. This medication works by completely blocking acetylcholine. That is the exact same critical brain chemical that is disrupted by Benadryl. And unlike some of the milder anticholinergic medications, Oxybutynin crosses the blood-brain barrier very easily. It directly affects the memory regions in your hippocampus. That specific characteristic makes it particularly dangerous for seniors, especially when it is used over extended periods of time. In a comprehensive 2019 study published in the British Medical Journal, researchers discovered that people over 65 who took strong anticholinergic medications like oxybutynin for more than 1 full year had a 49% higher risk of developing dementia. That is nearly 1 in every 2 users. What makes this even more concerning to me as a doctor is that the vast majority of seniors are never properly warned about these serious cognitive side effects. They are simply told the little pill will help control their bladder. They are never told that it may be actively accelerating their mental decline with every single dose. The cognitive harm is very often mistaken for just normal aging. My patients commonly describe feeling mentally foggy. They forget important doctor appointments. They constantly misplace everyday items like their keys. They suddenly struggle to keep track of simple conversations with their grandchildren. It is rarely connected back to the bladder medication until significant permanent damage has already occurred. If you are currently taking oxybutynin and you have noticed any mental changes whatsoever, I promise you it is not just in your head. You absolutely do not have to stay on this particular drug to maintain your bladder control. There are much newer medications available like mirabegron, which is sold as Myrbetriq. This medication works through a completely different mechanism in your body. It has shown significantly less impact on memory function. Number 6 is statins. Statins are among the absolute most widely prescribed drugs in the entire world, especially for people over 60 years old. They are intended to lower your cholesterol levels and drastically reduce your risk of heart attacks and strokes. Simvastatin and atorvastatin, which are sold under the brand names Zocor and Lipitor, are the 2 most commonly prescribed versions. But here is exactly where the serious problem begins. Cholesterol isn't just a heart health issue. It is an absolute brain necessity. Your human brain is composed of nearly 60% fat. Cholesterol plays a highly critical role in creating and maintaining the myelin sheath. That is, the thick, protective coating that helps nerve signals travel smoothly and efficiently throughout your brain. When you aggressively lower your cholesterol with powerful medications, you may also be starving your brain of exactly what it needs to function properly. In a 2023 study published in Frontiers in Aging Neuroscience, researchers found that seniors over 70 who had been taking statins for more than 3 years straight had a 26% higher risk of mild cognitive impairment. And those taking high-dose statins had even more noticeable, scary declines in their mental function. What is even more alarming is that some patients reported sudden-onset memory loss. They described frightening moments where they couldn't recall familiar names of their friends, recent conversations they'd just had, or even driving routes to the grocery store they'd traveled for years. I had a patient pull his car over to the side of the road because he suddenly forgot how to get home. He was terrified. Now, it is absolutely important to understand that not all statins affect the brain equally. Some medications, like pravastatin and rosuvastatin, do not cross the blood-brain barrier as easily. They are considered significantly less risky in terms of cognitive side effects. If you have been on a statin for years and you are noticing a heavy mental fog, increasing forgetfulness, or growing confusion, it might be time to have a very serious conversation with your doctor about a dose reduction or an alternative strategy. Number 5 is benzodiazepines. Benzodiazepines, which include commonly prescribed drugs like lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are some of the most widely prescribed medications in America for anxiety disorders and sleep problems. They work by heavily enhancing GABA, which is your brain's natural calming chemical that reduces overstimulation. At first, these medications seem like absolute lifesavers to my patients. They quiet the racing thoughts. They ease terrible panic attacks. They help with falling asleep at night. But over time, these drugs transform into something else entirely. They become a dark trap you simply cannot escape. A 2022 study published in the British Medical Journal followed over 8,000 seniors over a 6-year period. They found that those who had used benzodiazepines for more than 3 months had a massive 51% increased risk of developing Alzheimer's disease. The risk climbed even higher for long-acting benzos like diazepam, which remain in your physical body much longer and accumulate in fatty tissues, including your brain tissue. What happens is a kind of chemical sedation that progressively slows down the neural activity throughout your entire brain. That means your brain literally stops learning new information as quickly as it should. It becomes less flexible. It becomes less efficient. It becomes increasingly prone to deep confusion, scary memory gaps, and total emotional numbness. Seniors taking benzodiazepines regularly often describe to me feeling like they are moving through a constant, heavy fog. They feel disconnected from reality. They just do not feel like themselves anymore. And the absolute worst part is when they bravely try to stop taking the medication. The withdrawal symptoms like severe anxiety, wild agitation, and debilitating insomnia can be absolutely brutal. It makes the drug feel absolutely essential when it is actually the primary source of the problem. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly under any circumstances. This can be genuinely dangerous and life-threatening. Instead, work closely with a knowledgeable doctor to very gradually taper the dose down over weeks or even months. Number 4 is amitriptyline, sold as Elavil. Amitriptyline is an older tricyclic antidepressant that is still surprisingly commonly prescribed today. Doctors use it for chronic pain conditions, bad insomnia, and sometimes even migraine prevention. At first glance, it may seem like a versatile, multi-use miracle pill that solves several annoying problems at once. But underneath the surface, it is actually one of the most highly potent anticholinergic medications still in widespread circulation today. That means it powerfully blocks the action of acetylcholine. In fact, it blocks it so strongly that cognitive effects aren't just possible side effects. They are essentially expected, guaranteed consequences with long-term use. In a massive 2015 study published in JAMA Internal Medicine, researchers carefully examined over 3,400 adults aged 65 and older. They discovered that those who took higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. What is absolutely terrifying to me is that the vast majority of these patients were never once told that this drug could actively harm their memory function. They were often prescribed amitriptyline for annoying sleep problems or nerve pain. Then they slowly started noticing troubling changes, like short-term memory loss, word-finding difficulties, and an increasingly foggy concentration. It doesn't even require a high dose to cause serious problems. Even low-dose amitriptyline taken nightly over several years can create a slow, invisible erosion of your brain power that happens completely silently. The damage occurs without any clear warning, no clear symptoms at first, just a gradual decline that looks exactly like normal aging, but is actually drug-induced cognitive impairment that absolutely could have been prevented. Number 3 is paroxetine, sold as Paxil. Paroxetine is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, for deep depression and severe anxiety disorders. At first glance, it appears to be a highly modern, sophisticated antidepressant. It is supposed to be gentler and safer than the older generation of psychiatric drugs. But here is the critical part the drug companies rarely tell you about. Paroxetine is the only major SSRI medication that has significant anticholinergic properties. That one crucial detail makes it drastically and fundamentally different from its SSRI siblings like sertraline or escitalopram. In a large 2021 comprehensive review, researchers examined the cognitive profiles of elderly patients taking different SSRI antidepressants. They found that paroxetine users showed measurable, scary declines in short-term memory, verbal recall ability, and attention span within just the first 12 months of treatment. The study also discovered that seniors taking paroxetine were 30% more likely to show early warning signs of cognitive impairment compared to those taking other common antidepressants. The cruel irony is that paroxetine is often prescribed specifically to stabilize a senior's mood and reduce their daily anxiety. Yet it ends up systematically undermining their mental clarity and emotional regulation over time, completely defeating its own purpose. The American Geriatric Society has officially placed paroxetine on its Beers criteria list. That is a carefully compiled list of medications that are potentially inappropriate for older adults due to severe safety concerns. Number 2 is antipsychotics. This one is especially alarming and deeply disturbing to me because many seniors do not even realize they are taking a heavy antipsychotic medication. Drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally developed and approved to treat severe, heavy psychiatric conditions like schizophrenia and bipolar disorder. But today they are frequently prescribed off-label to elderly patients for very common sleep problems, mild agitation, or just behavioral changes associated with dementia itself. That's right. These are powerful drugs that were designed for severe psychiatric illness, but they are now being routinely used in nursing homes and hospitals for seniors who are simply confused, restless, or deemed difficult to manage by the nursing staff. I have seen them used as chemical restraints. The consequences of this lazy practice are absolutely devastating. In 2022, a comprehensive study followed more than 25,000 older adults. It found that seniors who were prescribed antipsychotics for behavioral symptoms were 71% more likely to develop rapidly worsening cognitive decline within just 12 months. This happened even if they had absolutely no prior history of dementia before starting the medication. Even worse, these dangerous drugs dramatically increase the risk of a fatal stroke, sudden cardiac death, and severe physical sedation. That sedation can directly lead to broken hips from falls, emergency hospitalization, or permanent institutionalization in a nursing facility. The physical mechanism behind this damage is brutal and direct. These medications aggressively suppress dopamine. Dopamine is absolutely critical for executive function and memory processing in your brain. When dopamine levels crash dramatically, your brain becomes sluggish, extremely slow, and totally unresponsive to normal stimulation. This is exactly why seniors taking antipsychotics often appear dull, emotionally flat, or completely zombified. Their beautiful personalities seem to fade away. Family members find themselves grieving for someone who is still physically sitting in the chair, but mentally and emotionally totally absent. If your loved one is on these, you must ask the doctor if it is truly medically necessary or just being used for the staff's convenience. Finally, number 1 is anticholinergic polypharmacy. This is the hidden danger that almost nobody talks about. It is genuinely one of the absolute biggest contributors to drug-induced dementia in the entire elderly population. You may have been expecting a single specific drug to top this list, but the most dangerous medication situation for rapid dementia in seniors isn't one particular pill. It is the silent, creeping, cumulative effect of taking multiple medications with anticholinergic properties at the exact same time. Medical professionals call this anticholinergic polypharmacy. Imagine this all-too-common scenario I see in my clinic. A senior takes diphenhydramine, Benadryl, every night for sleep. They take oxybutynin daily for bladder control issues, and they take amitriptyline for their chronic knee pain management. Each medication alone might cause only mild, barely noticeable memory problems. But when you take them all together, they compound exponentially. The cumulative anticholinergic burden on your fragile brain absolutely skyrockets. This isn't just a theoretical concern. In a 2022 analysis, researchers tracked over 280,000 older adults. They found that those with the highest anticholinergic burden had a massive 120% increased risk of developing dementia within 10 years. That is more than double the normal risk. And here is the absolute worst part of this tragic situation. The vast majority of these seniors had absolutely no idea they were even taking anticholinergic medications. Nobody had ever sat down and explained this to them. When you block acetylcholine from multiple different angles simultaneously, your brain doesn't just slow down temporarily. It begins to actively decay and physically deteriorate. The delicate neurons physically wither from chronic underuse. The synapses shrink and totally disappear. Your brain enters a hypoactive state that looks nearly identical to Alzheimer's disease on our cognitive testing. Correcting this dangerous situation doesn't require a miracle cure or an expensive medical treatment. It simply requires a thorough, comprehensive medication review. You must ask your doctor or pharmacist to carefully evaluate your complete list of prescription medications, over-the-counter drugs, and even your daily supplements for their total anticholinergic load. This is honestly the most empowering part of this entire video. Drug-induced dementia is very often completely reversible when caught early enough. When the heavy medication burden is finally lifted and removed, many of my senior patients dramatically regain their mental clarity, their physical energy, and their sharp memory function within just weeks or months of stopping the problematic drugs. Your brain is remarkably resilient and highly capable of healing, but only if you give it a real fighting chance by removing what is actively harming it. Polypharmacy isn't just dangerous and harmful. It is completely preventable, and that makes it the absolute #1 hidden medical threat to the minds of our entire aging population. Now, I want to hear directly from you. Which of these 9 medications are you currently taking right now? Have you noticed any troubling brain fog, increasing forgetfulness, or weird personality changes since starting a new medication? Are you willing to talk to your doctor this week about reviewing your complete medication list? Share your honest experiences and opinions with us in the comments section below. We genuinely want to hear from you. Your story could absolutely help another senior avoid this exact same dangerous situation. Please leave a like on this video and subscribe to Vital After 60. I am Dr. Arthur Hartman, and I am here to help you stay sharp, healthy, and strong for all the years ahead. Take care of yourselves. Would you like me to walk you through exactly how to ask your doctor for a comprehensive medication review at your next appointment?